There are several acute veterinary applications, I'm sure you're well aware, depending on what type of practice you work at. I'm not going to read the list, you could read it, but these are radiographs of a dog we're going to talk about a little bit. Josh was hit by a car and he fractured the caudal end plate of his L3, which was displaced ventrally into the right. He also had a right capital physeal fracture with the head of the femur displaced. On MRI, his spinal cord was intact. He underwent an FHO and L3 stabilization with screws and polymethyl methacrylate. We used laser therapy immediately postoperatively to the right hip and the spine and to his road rash. We couldn't employ other things like ultrasound or hydrotherapy because they would be contraindicated at this point. In our chronic cases, we can use this therapy on arthritis, skin, and a whole host more based on any geriatric that walks in the door. And as you can see here, laser applied correctly is very comfortable. With the upper left-hand quadrant, one of the most sort of overlooked in many practices is the chronic IBDD dog that scrapes their knuckles walking all the time. They get these little abrasions on their toes. You know, and for the most part, it doesn't seem to be bothersome, but when you actually start treating them, they feel a whole lot better and they walk a whole lot better. So this is one of the things I like to examine seeing an IBDD dog. The dogs on the bottom are getting their elbows treated, and we know that elbow dysplasia, elbow arthritis, and all the problems associated that can happen in the elbows, really there's not an incredible way to get rid of pain, but laser certainly helps. One of the modalities that we have that we can target. It's awesome to penetrate the elbow. And the upper right-hand quadrant, little dog treating the hip and associated tissues with that. And little dogs with FHOs, it's a great modality to treat them